We are back with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, right now there are about 120 coronavirus inpatients across the Huntsville Hospital system. It's almost 100 fewer than we saw around the end of July, but is that a number that you would expect right now, more or less?
So we're definitely happy about that in a way because it went down in compared to July. But what we've noticed now, Dan, is it actually went down and now it's flat and a little bit of increase coming up with it. So we're seeing a little bit more, but it's flattened up. So it is something that we've been looking for cases to go down, but we were hoping these cases continue to go down. I think part of it is, you know, as the schools and the sport keep going on, we're probably going to stick with these numbers. I hope not more than that, as long as people, you know, follow the guideline. But there's always better to have less and less cases,
sure,
hopefully.
The number of people getting tested for coronavirus in the hospital system has been around 400 during the past week, not counting Labor Day. Hospital CEO David Spillers says officials use this number to get a better idea of how many people are sick. So how should people look at this number now when we saw testing numbers average above 1,000 during points in July?
And again, I think it's a good sign of less people needing to be tested. But I mentioned that before as well. I've seen people don't want to be tested to know their results. So it could be part of it contributing as well. Definitely, or hopefully, people following the guideline, if they're sick, they come to be tested. So if these numbers are true or going down, these are good signs for us. We really want less and less because if you compare it to other states or other countries, they have much less people tested because the spread of infection is less, so the numbers of infection is less as well.
It's an unpleasant subject, but let's talk a little bit about the number of deaths. How accurate is the death toll, in your opinion? Some say we're undercounting, some say we're overcounting because of comorbidities. What are your thoughts on that?
Yeah, in my opinion, I think we're undercounting the numbers because, unfortunately, and it's been seen actually in New York, there was a lot of cases of people who died from coronavirus, but they died at their home. When there was a widespread infection and when there was a panic, you know, the hospitals was full, the ICU was full, so a lot of people didn't want to come to the hospital. So definitely a lot of these patients had complications from the corona, but they didn't come to the hospital, but it got to be found in autopsies and stuff. I really think it's undercounted because a lot of this is people is not coming when it gets panicky, and that's why I'm worried about the winter if something happened like that.
There are still a lot of questions about the future and the coronavirus. Almost everyone has their own guess when it might all be over, if ever. So where do you see us in terms of coronavirus impact for the start of the new year?
Yeah, my prediction is, and you know, I want to say one thing is we chose as a community to live with the virus rather than control it and get rid of the virus. And because of that, I think we're going to continue seeing this for at least 6 months to 9 months, unfortunately.
Wow.
Because, you know, the expectation is we were hoping this is going to go down, and we control it and get rid of it where we have only clusters of it. Unfortunately, we're still seeing infection in the community continuing, and some people is just not following these guidelines. So we're probably going to continue 6 to 9 months with this if we don't do a better job in controlling this.
So in your professional eyes, do you like what you're seeing in terms of masking and social distancing? And how important is it for people to continue to do that?
Yeah, I think it definitely got better in compared to what we had in May and June, but I think we able to do better and better in what we're doing at the moment, because in where you go out and see people in stadium, where you see people in stores, some of them really not wearing masks, and some of them don't care much about physical distancing. And that's what's concerning in there, where now you open the schools, you can have more exposures, and you're not going to be able to control it well. And that's the main issue. I hope people listen and follow the guideline. It's not that difficult.
Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
As always, thank you so much for your time and insight tonight, Dr. Hassoun.
Thank you so much.